what are some of the things that work to improve patient engagement? Some of those things are education about how people can self-manage, but it doesn't stop there. We also have to make sure that people are involved in decision making. So for instance, with Zach, if we were thinking about a healthful diet, telling Zach exactly what he needs to eat instead of offering him options would turn him off. But if we offer him, well, Zach, here are some things, what do you like? What do you enjoy eating? Involving him in those decisions is more likely to succeed. Emphasizing problem solving. Some of the people that we take care of are not good problem solvers, and we can teach them strategies, how to solve problems, and eventually they get better at solving their own problems. Developing a care plan that is a partnership, so not just what the care team wants, but also what the patient feels is important. And then that follow-up, that support to set little goals, little steps, following up on them over time. These are all things that we know work, all evidence-based things that can promote engagement in health and health care and really make our jobs a lot easier. Additional things that we can do would be to motivate people using information and support, targeted approaches. So if someone's struggling with physical activity, utilizing some targeted approaches like giving them options for physical activity, offering some ways that they could be supported with family or friends, things like that. Also, helping people understand what are the danger zones, when to take action, helping them not wait too long. We also know that some other things like managing social, emotional, physical impacts of conditions are important. A disease is not just a physical ailment. It really does impact social and emotional components of a person's life, and that's important as well. And then things like outreach or proactive follow-up and providing opportunities where people with similar conditions can talk with each other. A lot of work has been done on peer mentorship and how supportive that can be for people going through care dilemmas and situations that are challenging. So as we think about all of these things that we just talked about, how would Zach fit into this? He has an opportunity, he's at a care provider. We know that in primary care, depression is only discovered about 50% of the time it exists, so it may or may not be diagnosed. But probably as important as to whether Zach engages is how did he feel with his GP? Was he connected? Did he feel heard? Did he feel like he could say that he was using drugs or perhaps not following a treatment plan? Did he feel safe to do that? Was he given information or options about medication? Was he judged about what he was doing currently, or was he allowed to explore a better future? So each time a person interacts with the healthcare system, we have that opportunity to engage them, and we can use it or we can waste it. And so the decision really is, how do we, at an organizational level, really engage people every opportunity we have? And so the next steps and partnering with patients really has a lot to do with that patient experience. Some skills and tools that you can consider, and we're going to talk about these each one in turn, but listening actively, being intentional when you are meeting with someone, using respectful strategies, evoking what matters to the patient. We'll talk briefly about change talk, and then also action planning.